Hey everyone, welcome to another question and answer session for MRCS exam. Here this is the question. A 23 years old man falls and sleeps at nightclub. A shaft of glass penetrates the skin at the level of the medial epicondyle. Which of the following sequelae is least likely to occur? So in this question, a 23 years old man falls and sleeps in a nightclub. Sharp glass penetrate the skin at the level of the medial epicondyle, and we know that the medial epicondyle there is the ulnar nerve located, so there will be risk of injury of the ulnar nerve, and which sequelae is least likely occur, that means which is not the function of the ulnar nerve at these places. So here the options are the atrophy of the first dorsal interossei muscle, difficulty in abduction of the second, third, fourth, and fifth fingers, claw-like appearance of hand, loss of sensation on the anterior aspect of the fifth finger, and partial denervation of the flexor digitorum profundus. So let's see this in picture. So first of all, we can see as the damage of the ulnar nerve. Here this is the ulnar nerve is coming on the ulnar side of the forearm, and we can see it supplies the muscles here, such as this is the adductor pollicis muscle, and here we can see this is the dorsal interossei muscle and also the palmar interossei muscle. So the function of the adductor pollicis muscle will be impaired, then function of the palmar interossei muscle will be impaired, and the function of the dorsal interosseous muscle also lost. So these three important muscle or three important group of the muscle which is located in the hand, such as the dorsal interossei, palmar interossei, adductor pollicis muscles, and medial to lumbrical muscle, so they will not act normally. Then in this picture we can see this is the lumbrical muscle, then dorsal interossei and palmar interossei. Lumbrical, dorsal interossei, palmar interossei, so they all are supplied by the ulnar nerve. So lumbrical muscle, actually lumbrical 3 and lumbrical 4, and lumbrical 1 and 2, they are supplied by the median nerve. So the lumbrical 3 and lumbrical 4, they are supplied by the ulnar nerve. Then this is the dorsal interossei, it is supplied by ulnar nerve. Then palmar interossei, it also supplied by the ulnar nerve. And here we can see the dorsal interossei muscle is causes abduction. Here we can see the separation of the finger from each other. This is the dorsal interossei. So the function of the dorsal interossei, which is the abduction, so abduction of the finger will be lost. Then we can see this is the palmar interossei muscle, and this palmar interossei, it causes adduction of the finger. So due to injury of the ulnar nerve at the medial epicondylar area, the adduction power of the finger will be lost, and function of the lumbrical 3 and lumbrical 4 will be lost. So this function will be lost in this condition. Here we can see this is the medial epicondyle, and the penetration occur at this line, and here this is the ulnar nerve, so the ulnar nerve will be damaged in this events. And here in the second picture also we can see this is the medial epicondyle, and just behind the medial epicondyle there is a large nerve, and this nerve is the ulnar nerve. So due to stab in this area causes the nerve, this is nerve which is the ulnar nerve, so ulnar nerve will be damaged. And here this is the cutaneous sensation of the different nerve in the hand. And first of all we can see this is the fifth finger. So here this area is the fifth finger, and fifth finger, here the fifth finger and medial half of the fourth finger, it is supplied by the ulnar nerve, and it is the superficial branch. So superficial branch of the ulnar nerve, it gives sensory supply to the fifth finger and half of the, actually it is medial half of the fourth finger. Then we can see this is the flexor pollicis, flexor digitorum profundus, and this flexor digitorum profunda, it is supplied by the ulnar nerve. Here we can see the medial part, it is supplied by the ulnar nerve, but the lateral part, it is supplied by the median nerve. So flexor digitorum profunda, it is supplied by the ulnar nerve. So for this, during the loss of or injury to the ulnar nerve, here we can see this is the epicondylar area and ulnar nerve damage at this place. So ulnar nerve, all the lower area will be damaged, so all the function of the ulnar nerve below the elbow joint will be lost. So here, this half of the flexor digitorum profunda, it is responsible for the flexion of the distal interphalangeal joint. So this flexor digitorum profunda, it is responsible for flexion of the distal interphalangeal joint. So in this condition, distal interphalangeal joint flexion will be lost, and we know when the distal interphalangeal joint is flexed, it looks like claw like appearance. So due to loss of function of the ulnar nerve here, it will cause less claw-like appearance. So this point is important, as ulnar nerve it damage at the level of the medial epicondyle, there will be less claw hand. But when ulnar nerve damage will occur in the wrist area or other area, then we can see the flexor digitorum profunda, it gets supply in the upper part here. From the upper part here, it gets supply. So this muscle will act functionally, and for this region, this finger will be more flexed in the distal interphalangeal joint and causes more claw hand. So more distal injury, more claw hand in case of ulnar nerve, and more proximal damage causes less claw hand of this hand. So our final answer is ready. The claw-like appearance of the hand, it will not be occur, because as the nerve injured in the medial epicondylar area, so there will be less claw hand. And other options here, such as atrophy of the first dorsal interossei, it is true, because all the palmar interossei and all the dorsal interossei, they are supplied by the ulnar nerve. Then here, difficulty in abduction of the second, third, and fourth fingers, it is also true, because the abduction is done by the dorsal interossei muscle, and dorsal interossei muscle is also supplied by this ulnar nerve. And then loss of sensation of the anterior aspect of the fifth finger, that means the little finger, it is also true, because the ulnar nerve, it gives sensation to the fifth finger and medial half of the fourth finger. Then partial denervation of the flexor digitorum profunda, it is also true that the flexor digitorum profunda, its medial half is supplied by this ulnar nerve. So our answer is claw-like appearance of the hand. It will not occur in case of the ulnar nerve injury at the medial epicondyle. Thank you all.